Let me welcome you to this session and let me thank you for accepting to share your views and experiences on health, the environment, and the Sustainable Development Goals from global health to local development. I would say this is a timely discussion. We are honored here to have the presence of Mrs. Ana Garcia de Hernandez, the First Lady of Honduras, who will share how Honduras has embraced health as an objective at the highest political level, incorporating the living environment. I think you heard from the President himself, who showed that he has quite an understanding of the health issues and that he is an advocate for health. So welcome, Senora Primera Dama. Secondly, let me welcome Dr. John Boyce, Minister of Health of Barbados, the chair of the WHO Conference on Climate Change and Health that has set the agenda for the discussions in preparation for the United Nations Framework Convention on Climate Change. He will share his experience on building resilience on climate change in the Caribbean. Third, let me welcome and thank Dr. Anibal Velasquez Valdivia, Minister of Health of Peru, for the country's leadership in this area. Last but not least, I would like to welcome and thank Jane Nishida, the Principal Deputy Assistant Administrator of International and Tribal Affairs, U.S. Environmental Protection Agency, who has agreed to share the experience of the EPA in setting standards for the United States and in supporting countries in this region and the WHO regions to advance the control of hazardous environmental exposures, particularly on air pollution, lead and mercury, making our world safer for our children and for future generations. I need also to welcome and thank our guest moderator, Ms. Alejandra Ora, CNN presenter, who has been so kind to accept the challenge of leading this complex discussion. I wish to just preface this panel discussion with a few words. WHO's General Program of Work 2014-19, in its leadership priorities, it includes the need to address the environmental determinants of health as a means of promoting health outcomes and reducing health inequities. Up to 25% of the burden of disease could be prevented by timely action on the environmental determinants of health. It is also well established that environmental risks are disproportionately concentrated in the population groups living in situations of extreme socioeconomic vulnerability, which make them part of the web of causation of health inequities. The region of the Americas has a very complex situation. Some countries are among the largest consumers of pesticides per capita and per hectare of land use, 3 of the largest producers of lead, and 2 of asbestos are in this region. And small-scale gold mining is frequently illegal and widespread, being responsible for most of the mercury contamination. Household and ambient air pollution rank first and second in the environment disease burden in the Americas. In the year 2012, some 81,000 and some 152,000 deaths were attributed to household and ambient air pollution, respectively. Although access to water is covered under a specific SDG goal, water contamination with chemicals and water disputes are the most frequent source of environmental-related conflicts in the region. The region of the Americas has made sustained progress in improving the health of its population, and there is also notable progress regarding the human development indicators and on the reduction of poverty and inequity. And we have had positive trends in terms of the Millennium Development Goals. But while we celebrate these important milestones, we all recognize that much remains to be accomplished, and huge health inequity gaps between and within countries pose a great challenge to health and well-being. Our strategic plan is very ambitious, but it is feasible and much needed, in fact, in the area of sustainable development and health equity. The theme of this session, I dare say, is relevant to the SDGs for 2030, and which will require much attention, not only from our member states and the Secretariat, but of all sectors of society. Let us listen to this panel discussion with a view to addressing how are we going to best position our work to ensure that we can meet the SDG goals in this area. And so it is my great pleasure to hand over to Alejandra, who will moderate this panel discussion. Thank you for your attention.
Good afternoon, and thank you very much. I thank the Pan American Health Organization for having invited me to have me take part in this panel and to have on this panel people who can literally change the lives of millions of people in our region, in all of the Americas and the Caribbean. It's an honor to be a part of this directing council and to see firsthand, as we say it on our network, to see where news is happening. So I would like to invite everyone who is watching us here at the headquarters of the Pan American Health Organization so that everyone watching us would be able to send in their questions. The hashtags or the trends to talk about what's being discussed here at this panel are as follows: OPS, CD54, it could also be PAHO, PAHO, CD54, and the Twitter address would be OPS WHO at WHO. We also have a web page where there's live streaming of all of the questions and where the viewers can submit their own questions. livestream.com/PAHO or OPS/WHO. And so everyone here can also interact with the panel. At the end of each line here, we have people who have cards on which they can write. You can write your questions to take part in the Q&A that will ensue the remarks made by the panelists. So first, I would like to thank everyone for being here, and I'd like to start with you, First Lady. I think in this 21st century, especially in the case of your husband, President Orlando Hernandez, much has been done and learned about gender equity to include social programs empowering women. And gender equity and feminine empowering is something that we hear a lot about at organizations such as this. You've got the He for She campaign, for example, at the UN, headed up by two people who are known as being very influential in the media, entertainment media. However, you are much more than a First Lady. I think nowadays being a First Lady is being someone on the being a partner of the President. I would like to start by greeting everyone here in the public, the audience, Alejandra, and all of the panelists. I'm very happy to be here to talk about a topic that's so important, such as is the health of our populations in countries such as Honduras, in which it's still a problem, but that affords us opportunities for improvement every day. And of course, the role of women needs to change every day. Yesterday, my husband at the UN Assembly took part in a very important event in which he took on a commitment as a nation that our nation will pursue to achieve this gender equality so that we women can also have all these opportunities to take part in the different venues and opportunities that our country affords people, because as women, well, this represents the opportunity for development in our country, a country in which women have power, where women feel empowered in their role, that can make a difference for their family, from their home, in their community, at their workplace of work. Now, from my position as First Lady, beyond simply being a social representative, we try to involve ourselves in different projects, some of which have to do with health, a better life program. Vida Mejor is one of them. My husband talked about that this morning. And this gives us opportunity to really make a difference in the quality of our lives and the lives of families that are marginalized, sidelined. And there's a very important component there around women. And we have put forth a comprehensive program along with other government institutions in the area of preventing teenage pregnancy, which has a lot to do with equality for women. Other related topics that relate to the life of the most vulnerable among us. Early childhood, for example, is something we're focusing on so that we become spokespeople. That there be a political will to follow through with this, and that there be cross-cutting, articulated work in public and private sectors with organizations such as PAHO here, all of which make it possible for us to see more effective results in a shorter time frame. Social inclusion and feminine inclusion can be achieved. And so let's continue. Now we have Jean Mashida.
We are talking right now about women, equal rights, social inclusion in Latin America, especially in Central America, where unfortunately the rates of domestic violence are high, which is something that is changing throughout the years. But you're currently in charge of our future, which is our children. So I would like to ask you, how is the global environmental agenda used to make life safer and healthier for our children?
First, let me thank PAHO and the organizers for inviting me to this important event. With regards to your question, the US EPA, my boss, Administrator McCarthy, feels very strongly that our mission at EPA is not only to protect the environment, but to protect public health. And in fact, and I think some of you were at the World Health Organization Executive Board, where she became the first environmental minister to address the executive board of WHO, making the point that there is an integral link between public health and the environment. It manifests itself in three ways in terms of air quality and climate change. Many of you who are obviously health professionals know that air quality contributes to respiratory diseases as well as mortality. In fact, the WHO issued a landmark report on air quality where they said that 1 out of 8 deaths are associated with air quality. The second area that it manifests itself is in terms of water sanitation, whether it is access to safe drinking water or whether it is access to safe sanitation. That again creates risk, particularly to the vulnerable like women and children. And the third area has to do with toxic or chemical pollution. It was mentioned earlier that we have many toxic chemicals within our global environment that affects health, and particularly, again, the most vulnerable, particularly with developmental problems. They include lead paint, they include mercury, as well as something that perhaps you don't think about, and that's e-waste in terms of some of the toxics that are in our electronic equipment. Thank you.
Thank you, Mrs. Nashida. Quisiera
Now I'd like to speak with the Health Minister of Peru, Ms. Velázquez, Anibal Velázquez. We've talked about two key aspects, women and the future. And now I'd like to know what the government of Ollanta Humala has done, the ministry, to improve the health and lives of children and women in Peru. So thank you very much. I thank the Pan American Health Organization for allowing us to share Peru's experience. Now in Peru, what the President Humala has implemented is the social inclusion policy, and what has been done is to make an effort to bring low-income people together and to reduce poverty, to enhance services provided to them, and to ensure a better quality of life for Peruvians. Now, we have implemented policies geared toward strengthening healthcare services, generally speaking, but also to bring together the state's actions around social goals. That's one of the purposes of the Ministry of Social Inclusion and Development, so that we have social policies implemented in a cross-cutting way. The environment, of course, is very important to health, and is understood increasingly so, and that calls for a considered effort on the part of high-level authorities, but of all sectors, and this can be worked into an articulated plan to reduce environmental pollution, to reduce the impact or mitigate the impact of climate change on the population. So strengthening services allows us to be prepared for these contingencies. So what we've done is make a huge investment in the health care system, in collective health, as well as individual health, with universal coverage protecting all Peruvians. All newborns have health care insurance and is affiliated automatically irrespective of one's socioeconomic level, and that makes it possible for us to have a human rights-based healthcare system. That is the right to health. And so the state is committed that services will respond to that right, will rise to providing or upholding that right. Maternal and child health, non-communicable diseases, and those resulting from pollution. The state understands that it has to effectively respond to these challenges, and this was done by a results-based policy, an evidence-based policy, and this is what makes it possible for us to, events like this, to exchange experiences, to generate evidence with which to make better decisions. Thank you, Minister. And I would like to give the floor to the Health Minister of Barbados.
I've been covering in the news drought in the Caribbean, and it's been pretty bad this year, actually, and it's expected to worsen, especially with the effects of El Niño. So I wanted to ask you, what can Barbados and the health sector do to diminish the effects of the drought that have deeply hit Barbados?
Thank you very much, and let me express my appreciation to the PAHO and the organizers of this panel discussion. I believe it's the first time I'm going to have the opportunity to be part of a CNN production, so I'm really honored at this opportunity, and of course to join this very distinguished panel here. I think the question of climate change, El Nino, or whether it be flooding or any other event, is clearly established in the works that indicate that small island development states do suffer from the threat of and are most vulnerable to climate change, although in fact they are the least contributors to the aspects of global warming, which are irrefutably part of the reason for the severe climate changes that we have been seeing. In the Caribbean, of course, we are part of the hurricane belt as such, and this is especially threatening. My colleague from Dominica, I know, will make a presentation very shortly on the recent impact of tropical storm Erika in this country and the level to which it has set back the development of that country. The fact that the Caribbean states depend very much on agriculture and tourism as their economic drivers is one of the reasons why we have to pay such essential attention to these facts. And of course, the threat of disease burdens associated with climate change are always relevant. We've been presenting at world bodies, and I know that my Prime Minister in the United Nations this week will make the point again that in looking at the development of, or the maintenance of our development in the Caribbean, those who are planning for assisting and developing programs for our sustainable development must bear in mind the unique vulnerabilities of our states. And we believe that there must be special accommodation for these very unique vulnerabilities of small island developing states. In this way, we can have some level of funding made available, for instance, so that we can shore up the gains that we have been able to make in healthcare improvements in our countries. If we don't do this, of course, the entire country is threatened, and indeed, the entire economy is threatened, because by extension, those who visit our shores as tourists or visitors would not be attracted to our islands. The even more recent threat has been the advent of sargassum weed on our beaches. And of course, tourism, as all of us know, is driven by the fact that we go on the beaches and we relax and we enjoy the ambience of the sea, water, and sun. So if we take the sand away by covering it with sargassum weed, as was demonstrated certainly in a number of our Caribbean countries this summer, we threaten the very existence and the very sustainability of our economies. So I think the point we want to make is that the entire picture has to be broadened as we continue to look at healthcare, at maintaining healthcare in our countries. And I speak of the Caribbean, not at the exclusion of other countries in Latin America who have threats which may not be the same, but threats nonetheless, so that we understand that in modeling our development in the future, we must make some provisions for these very important and real vulnerabilities.
Thank you, Minister. Bueno, retomando el tema de la sequía, como
Going back to drought, First Lady, and talking about drought, Honduras has been one of the countries that has been most affected, in fact, this year by these droughts, and obviously it's as a result of the climate change. According to a recent report, in fact, it's one of the 3 countries that has been most affected by the climate change. I was just recently reading in the national headlines that 250,000 families had been severely affected as a result of this. And we're talking about families that live thanks to their harvests like coffee, and you know that they're one of the largest coffee exporters in the world. I hope my country, Venezuela, doesn't hear me saying this, but anyway, tobacco as well, and sugar. What is the government doing right now to fight against this drought, which, as I just told the health minister of Barbados, unfortunately does not seem to improve, or is not going to improve in the next few months? Well, the question of the drought and climate change are things that have a serious impact for many of our countries in the Caribbean, Central America, and particularly Honduras, which have been defined by an organization called German Watch as one of the 3 countries, and unfortunately for us, we headed it being the first in line, that most suffer from the effects of climate change. We have had floods, natural disasters like the Mitch hurricane and others, and now this recent year, or I should say the last 2 years, the devastating effects of the El Niño phenomenon. What this means is that our country has less and less rainfall, and when it does, it's so much that it causes tremendous floods. So what are we doing? Well, we understand that the first thing is to guarantee the food security of our families, because the droughts, in fact, affects the health of our families, because they have no access to a lot of the food that they themselves harvest. So we have distributed food through programs like the PMA and with our own resources, but we've also tried to change the attitudes of many of the Honduran families, particularly the farmers, through the Vida Mejor, Better Life, that my husband explained a while ago. We have tried to protect the life of the families within their homes. The change of the traditional stoves, the open fires with these eco stoves, not only takes care of the health of these families and their women in particular, but they also have a favorable impact on the environment because we avoid deforestation and the emission of more contaminating gases. We're also implementing, and my husband has done an excellent job in recent weeks, trying to find ways to protect the forests, the water basins, to get a better understanding of what's the soil resource for and how we work with it. Because if we can understand the soil better, we can guide the farmers more in that direction. We've started a strategy of setting up water harvesters. What I'm saying is to find ways to capture the rainfall so that the water can be used in the homes, in some cases when it's only done in the households, or in communities where the farmers can use that water to do the dripping irrigations. This morning my husband mentioned the case of a farmer that we visited just recently who had his lot with no production. He'd lost his crops. And imagine Honduras, like most of Mesoamerica, has its diet based mainly on beans and corn. And that's what they plant. The most vulnerable populations do this. He'd lost it all. And I'm talking about a visit that my husband did at the beginning of this month, September. On the very next day, we set up the irrigation system. And it's 28th of September, we're getting pictures all the time because now it's become a symbol of what can be done when you change the attitude, when we teach them other ways of producing, and when it's done friendly, with user-friendly or environment-friendly, I should say. Now he has his corn plants much bigger, and that will probably guarantee that he'll be able to feed himself and his family in the next few months. And in this way, we're also contributing to the health of these families. And there's many of them in Honduras who now have the availability of the food and will be able to have better health. And the question of water, which is also fundamental, since when it doesn't rain, there's scarcity of water, and often the families are forced to drink water straight from the few sources around without taking the necessary care. So the use of the water filters guarantees that these families will not be spending additional money. They'll be able to use these filters to drink clean water, pure water, based on our needs as humans, and avoid diseases, the gastrointestinal diseases. Thank you, First Lady, and we'll be speaking a few minutes later of the Vida Mejor, or Better Life program. And we'll also hear why your husband is known as Mr. Stove. Well, it's because of his stove, his eco stoves. Let's go back to Mrs. Anshida from the EPA. The climate change issue and children.
In climate change and health, and are currently the children suffering from health-related problems due to climate change?
I think actually the speakers before me did a very good job of illustrating the impacts between climate change and health, but I'll try to elaborate on some of the points that they raised. With regards to the drought impacts, climate change, the severe weather events that we are all facing, whether it's here in Latin America, Europe, or the United States, are impacting our habitat, which is affecting food security, as the First Lady indicated. It is also affecting, obviously, island nations like Barbados in terms of being able to be resilient. And that in turn has an impact in terms of public health. As I mentioned, it was reported by WHO that 1 out of 8 mortalities are associated with air quality. And air quality is in terms of addressing it, has the co-benefits of also addressing public health. The United States, under President Obama, has an aggressive climate action plan. We are all focused on the Paris, the COP21 meeting that's going to be happening in December. And on part of the United States, in terms of EPA, we have come up with an ambitious plan to address some of the major sources of pollution that are contributing to climate change, coal power plants, vehicle emissions, whether it's light duty or heavy duty vehicle emissions. But I wanted to follow up on what the First Lady said with regards to public education, and the business community in terms of technology. Because we also think while the government has obviously a critical role to play in endorsing climate change, so does obviously our private sector as well as our general public. In terms of the private sector, we believe that actually this provides opportunities for cleaner energy, green growth, and we have already seen a dramatic shift in terms of energy development to cleaner energy that we think will address climate change and at the same time also address public health. I know that countries are now submitting their what they refer to as their INDCs for the COP21. Mexico is one example where they have taken an aggressive attitude in terms of what they are adopting. In addition, in terms of the public awareness, we believe it's very important that the public be aware of the air quality and how it affects public health. And the best way to do that is to be transparent and to share information. You may have heard that the U.S. Embassy in Beijing put out air quality monitors where we shared information with not only American residents in Beijing, but obviously the Chinese population that lives in Beijing. That had an effect in terms of not only increasing awareness of the air pollution problems in China, but also being a motivator for the Chinese government to come up with new standards. Likewise, we are working right now under the U.S.-Mexico border program. I just came back from a meeting with the Border Health Commission where we're working with the Border Health Commission to be able to share public awareness with promodoras, with all healthcare professionals along the border to show them again what the impacts of idling vehicles are, what the impacts of again, air pollution sources and how you as an individual can change your behavior and also help us reduce climate change.
Thank you.
Mr. Velasquez, Health Minister of Peru. Mrs. Ishida just mentioned the Summit of Climate Change of the United Nations that should take place end of November, beginning of December in Paris. But you were part of the last year's summit known as COP20. Could you tell us what the conclusions and development plans were at that summit? Yes, thank you very much. Peru was chairing the COP20, in fact, after 20 meetings where we were able to at least the term health be included in the agreement. This has been a struggle for many years, despite the fact that there's information and evidence showing the relationship between climate change and health. Yet what we saw as part of the COP20 organization in Peru was that the health sector was not participating in the negotiation tables. It was probably limited exclusively to the economics and environment ministries, and the discussion revolved around development mainly and climate change. So we saw that for years we tried to include the question of health in the COP agreements. And finally, we were able to include in the COP20 agreement, which will be signed in Paris, include the term health. And we've only managed to include it in item 19. Just to show you, the change in the text is that at the beginning what it said was to decide to continue with the technical analysis of opportunities with high mitigation opportunities, including those related to co-benefits in adaptation and sustainable development for the 2015-2020 period. What we did with the help of the World Health Organization, and what was most important is that it was a young group of medical associates who did interesting activism. whereas the government in Peru, we offered our full support to them so that we could achieve this small change was to add the term health in that item. That was all we were able to do. As a starting point of what we'll be able to do in next conferences to add health to these agreements. So what now we have now is to decide to continue with the technical review of the opportunities with high mitigation opportunities, including those related to co-benefits in adaptation, health, and sustainable development for the 2015-2020 period. That doesn't mean that that's already been decided. Now we have to work all together, all of us who believe that the climate change does have a significant impact on the health of the people, so that we're able to agree this and sign it in Paris. That was just the starting point of what's actually happening, so that we have organizations like ours or states can dedicate resources, efforts, and get better documentation, because the relationship between climate change and health requires more investigation, and we hope that it will continue because we feel this is vital. Thank you, Minister. Coming back to the Health Minister of Barbados.
Characteristics of the islands in the Caribbean, specifically your island Barbados, make them more vulnerable to the effects of climate change?
Well, again, I think that we have identified our small size as being one of the most important characteristics. We are essentially surrounded by water, so the flooding, sea level changes, the effects are immediate again. And the whole question of air temperatures, and you spoke extensively about droughts, and the whole question of diseases that are airborne, sunstroke, and these kind of issues are very, very important issues. The other real factor in our region and in Barbados, especially, I can speak to, is the question of our children and the question of heat and the whole environment that they are experiencing in their schools. Increasingly, as we have temperature rises in our atmospheres, we are getting more and more complaints of headaches and children and teachers being ill in our schools. And actually, we have already reached out to the Pan American Health Organization and WHO to assist us in identifying ways of dealing with these issues upfront and early, and try to mitigate the effect and the impacts. One of the approaches we have taken is what we term an inter-ministerial approach within the government of our country, so that the education ministry is not in the battle alone in the schools, but they're in that we join them as a Ministry of Health, so that we can place doctors and nurses within the school environment in a timely fashion to identify early cases and sort of help to mitigate against them. Again, in terms of our social programs, our Ministry of Social Care gets out into the communities and makes sure that the communities that are most threatened are identified early for infrastructural improvements and for the things like water and food, etc., to be available for them on a timely basis. So I think that this debate has brought our ministries much closer together in trying to understand how we go about tackling this whole question of making life more bearable for our young people, and indeed for the entire community in the country.
Thank you, Minister.
Coming back to you, First Lady, we just mentioned in the last comment the Vida Mejor, or Better Life program that President Juan Orlando Hernandez mentioned in his inaugural session. But I'd like to come back to it with you. Can you tell us exactly where does the Honduran society try to benefit from this, and how is it done to give the Hondurans a better life? Well, the first thing I'd like to say is that through Better Life, because we have to recognize that the climate change is closely related to the health of our people. And we, within the framework of this new conference on climate change, we've spoken of the fact that for us, the better life gives climate change a human face, if you wish. Juan Orlando at the Assembly of the United Nations said, when they agreed to the Sustainable Development Goals, climate change was mentioned considerably, and I can almost paraphrase it, that sitting around the room, we're all the same, and we all have the same rights. However, if we see it from the point of view of climate change, we're not the same. We're not the same. Those countries that produce greater damage on the environment, and we're not the same as countries like his and mine, where probably we are the ones that suffer the most from the consequences of climate change. So I think it's very important for us to underscore the responsibilities that we all have as countries, as a shared and common responsibility, because we share the earth in a differentiated manner. And I believe that each country should assume its commitment and deal with the possible solutions we could find for climate change. With Better Life, or Vida Mejor, we begin by seeing what's happening within the household, because often we're not even aware of what's happening in the household itself, because that's probably where we should be safest, and yet that's probably where we have the greatest pollution. In my country, and I'm sure that in many other countries in Latin America, where most families cook with these open fires, are often exposed to the pollution that comes from the wood burning. Many women are not even aware of the damage this can cause to their health. With Better Life, we've started to create that awareness so that they recognize that there's a risk to their health, to their life, of the women and children that are in the household. By promoting the change of these open fires with the ecofogones, or eco stoves, we've reduced a considerable number of respiratory diseases. Often people say, I have asthma, when maybe it's really not asthma, it's that they're breathing that it's the COPD as a result of breathing that smoke. Others have eye problems or heart problems. So there are many diseases that we could avoid if we give our families access to more modern and better technologies, clean technologies for the environment. To use this eco stove would have considerable savings with the wood. From our studies, we've seen that for each eco stove installed, we avoid the cut of about 15 middle-sized trees. So we're protecting the forest directly. And our program of A Better Life, through the Eco Stove program, has just been recorded in the United Nations system as one which preserves and helps to care for the environment. It's been proven that each eco stove avoids the emission of 4 tons of carbon dioxide a year, which means that we're contributing to the planet by preventing these families from continuing that pollution with the use of the open fires. These programs that often go from policies to actions are very helpful, because often what our populations need are concrete actions, concrete results, and not something that's going to happen in 15 years. They need it right now, this very moment. That's why it's so important for us not to forget that behind each number, behind each statistic, there's a human being. There's that person that we have an obligation to, and most of us here as people involved in the health area should agree to find solutions to the problems of these people, particularly if it's related to the health of the poorest and more excluded families. Thank you, First Lady, and this will be the last round of questions for the panel. We have about a little bit less than 15 minutes, so I want to invite you all to ask questions, to write them down and send them to me. Patricia from the Pan American Health Organization can pick up these questions and send them to us. If you're doing it through the streaming, you do it through the PAHO streamline. I'd like to ask Mrs. Lishida now from the EPA.
Drought in the Caribbean. We know how deeply it's been affected in Barbados, in Honduras, even in Peru. We've talked about flooding. We also even heard the other risk on health, but what is the main environmental risk that Latin America is currently facing 2015?
Let me say that there are many risks that Latin America is facing, but let me highlight three that we haven't talked about yet, because I think it's important to raise them in this forum. The first one that I wanted to raise was food waste. Just this Saturday, I was in New York at an announcement. For those of you, you know that there is a sustainable development goal with regards to food waste. I was there for that announcement, and one of the things that I think is important is that unfortunately we have 795 million people in the world who are suffering from global hunger, and many of those live in Latin America. And unfortunately, at the same time, we, in terms of the developing world, are wasting about 30% of the food that we generate. So it is a great disconnect between the needs of the poor in terms of food and, unfortunately, the waste that the developing world has with regards to food waste. And so one of the areas that I think that we want to work with PAHO and with the countries in Latin America is how can we, in partnership, try to reverse this so that we are recovering food waste, that we are being able to put that to donations to help the poor who are in need of, obviously, food, nutritious food, and to, at the same time, reduce the amount of waste that goes into our landfills that also contributes to methane gas and climate change. The second area and challenge that we haven't talked about is mercury pollution. And mercury pollution is a problem in Latin America as well as in Africa and other parts of the world. Mercury pollution affects, obviously, 80% of the mercury pollution comes globally into the air, and unfortunately what goes in the air must come down, and it goes into our waters, into the fish. In many countries in Latin America and the developing world, obviously, we are sustained on the fish that we eat, but unfortunately, much of the fish that we eat have mercury contamination. In addition, we see mercury contamination in artisanal gold mining, which again is a very important industry in many of our countries. So EPA is working on a technology that actually reduces 80% of the mercury from artisanal gold shops. We are working on pilots in Peru and Brazil to be able to introduce that technology. But it's an example, again, where we believe that innovation and technology can help us reduce a serious public health risk. The third area that I wanted to highlight is on lead paint. In the United States in 1978, we eliminated lead paint lead in our paint. We actually now have a standard in terms of lead paint, which is 70 parts per billion. Unfortunately, in most developing countries, and that includes countries in Latin America and the Caribbean, the rates can be close to 16,000, 20,000 ppbs. Lead paint obviously affects the development abilities of children, and that in turn obviously affects their livelihoods and affects their ability to be productive adults. It is a problem that can be solved. We have solved the problem of lead paint in lead in gasoline. We're working in partnership with the UN. We eliminated lead in gasoline in most parts of the world. We challenge you to work with us and PAHO and the Global Alliance to Lead Paint to be also to reduce lead in our paint, which puts children at risk. So with that, I just will close.
Thank you, Mrs. Nashida from the Environmental Protection Agency. Ministro de Salud de Perú.
Minister of Health, Peru. Mr. Velasquez, we've just heard about the most important risks to the environment in Latin America. And at the end of November and December, you'll be saying goodbye to COP20 as we go into COP21. What are the most important issues and what has been learned throughout the year, things that need to be taken into account for next year? Thank you very much. Yes, basically the commitment that all countries have undertaken is to try to reduce the emission of carbon, and this is going to contribute to bringing down or diminishing the greenhouse effect, and this will benefit everyone, especially the future of the world, generally speaking. Now that this possibility has opened up to us and we now look at health as being brought into the convention as an annex or an additional aspect of it. But countries have to make very important decisions in order to allocate resources to improve their systems to reduce emission of carbon and for us to reap the health benefits of that. Now, countries are undertaking these efforts. A very important experience that we've been talking about is reducing pollution within our homes. And we have evidence that being able to reduce pollution in our households, improving our kitchens and our stoves, has a positive health impact. However, we've learned that we have to move toward cleaner technologies. Gas, for example, we've had a very interesting, worthwhile experience in Peru. It's become an important policy now reducing carbon emissions, and that is universal usage of gas for cooking. 1 million homes in Peru that used firewood are now using gas, natural gas, and this has a very important impact on health. And this goes to show that you can really have a positive health impact when you turn to clean technologies. This is the type of experience we want to broaden access to gas or natural gas in kitchens as well as in cars. Experience has shown that industry has saved $5.5 billion in making the switch to natural gas, reducing at the same time the emissions of carbon. And so it's a matter of taking the initiative and to adopt clean fuels, especially those that will have a positive impact on people's health. Now we've got the El Niño phenomenon, which is something of concern, especially in Peru, which has made a proposal to be considered by the Directing Council in a resolution, making a call to countries to prepare for El Niño and to coordinate our activity, our international cooperation. We know that El Niño is going to have an impact on our countries where there's going to be a rise in rains, but other countries are going to be hard hit by increased droughts. And this is going to have an effect on people's health. This is a recurring, periodic event, El Niño. We know it's going to come, and so we have to be prepared for it. So member countries of PAHO ought to work together, and through this resolution, we can make that cooperation effective, have it put on the agenda. So the important thing is here is that El Niño has an impact on the economies in our countries, and it could bring down by 1 or 2 percentage points our GDP. The economic aspect is important, but I should also say that this is something that goes back thousands of years, back to the Inca and pre-Inca times. And it's interesting to see how the world has changed. Before the center, everyone thought that, the world indeed did revolve around the climate, and now we're all focused on economic growth and GDP, not on the climate. We have to go back to how things were and go back to what our ancestors once thought, and that is have climate help us make our decisions. So thank you, Health Minister. We're 5 minutes from finishing, wrapping up this panel, so I ask you to be as brief as possible in your responses.
Mr. Boyce. This question comes from Sumi Mehta, Senior Director of Global Alliance for Clean Cook Stoves. The question would be, what is the role of the public health sector in ensuring health benefits of addressing environmental or energy-related issues like household air pollution? I know other sectors warmly welcome this opportunity for active engagement from ministries of health.
Well, I think the sector would be charged with the responsibility of setting and monitoring the standards which are going to be accepted and which are going to be allowed to operate in our countries. I think too that in setting these standards, sometimes we have to spend a little time also in educating the public as to why we are making these changes or taking these specific initiatives, so that it is not seen totally as an additional burden or additional cost to our way of life, but that in fact it is an investment in the fact that we need to save our planet more or less and to save our countries for our children to be able to benefit significantly.
Thank you. La pregunta va dirigida ahora al ministro de Salud.
This question is for the Peruvian Health Minister. Please be brief in your response. The Organization of Medical Students asks, how do you think youth, and specifically doctors in training, should be involved in climate change? I think they're already involved. The experience that we had in the COP20, that association played a very important leading role, and that goes to show that there are greater opportunities for youth to take part in these fora, and the thrust that young people have in these issues are going to become increasingly important for future generations, and so we think that your role is key.
For Mrs. Nishida, Environmental Protection Agency, the adverse impacts of drought on the economy and the environment are generally not understood, and they're poorly assessed, and they're very low. Currently, there's not enough policies to address the impacts. So the question is, what can PAHO, the Environmental Protection Agency, or other organizations play? What can they do to help create policies that could address this matter?
I think that's an excellent question, because one of the challenges, as I mentioned earlier, is making sure that the public understands the direct impacts between situations like drought and public health. So we, both EPA as well as PAHO and the representatives in this room, I think have the challenge, but also the opportunity to better message, I think, that linkage. And so using social media, using events like this, I think we can work together to make it very simple to the public about why a severe weather event actually impacts a country like Barbados, or impacts a country like Honduras or Peru with regards to public health.
Thank you, Mrs. Nishida. Y yo creo que la propagación de información como esta que hemos
I think information such as what we've just heard and having a broadcast here is key for us to tackle a number of risks that will result from climate change, and that's precisely why I invite you at the end of this session to share the video on the webpage I mentioned before, WHO or PAHO WHO, or its a Spanish counterpart. On that website you'll find this video and you can spread it around. And so with this we conclude this afternoon's debate. So the tent behind the building, there is coffee and dessert for a brief break, We have to clear the room for the next panel, and please come back as soon as you hear the bell. It's been a true pleasure for me personally to have taken part in this event. First Lady, Minister, Ms. Mishida, Health Minister, thank you all for being here with us. See you at the next session.